we have some great panelists who I'm very grateful to join us. I'll go through them in alphabetical order, I think. So starting with Dame Carol Black, who has a career in medicine, a consultant in rheumatology, was also the president of the Royal College of Physicians, the president of Newnham College, Cambridge, and amongst many other things, she's currently the chair of the Centre for Aging Better. We have, sorry, I've got to get my alphabet right. David Meredith, who's a partner at McKinsey, specialising in hospitals and health systems, as well as spent time in the US with non-profits. And last but famously not least, Alana Officer, who's the unit head of demographic change and healthy aging at the World Health Organization, which of course is at the heart of the Decade for Healthy Aging. So we've had from NAM this comprehensive overview. So let me perhaps start with you, Carol, and let me perhaps pick up on any dimension you wish, but thinking on the social capital chapter in particular and the Aging Better agenda and where you see the situation in the UK.
Thank you very much. I mean, first of all, let me say I really enjoyed the presentation. None of us could disagree with anything you have said. But my real, I suppose, frustration and desire, I like to see things happen and to see things change. When I think about, particularly in that chapter, your emphasis on inequalities as we get older, and the fact that you need to go across lots of dimensions of inequalities to change that, and it needs to be a life course. I then just want to relate that to where we are in the UK at the moment, because I listen and I think we couldn't be further away from where you want to be and where we should be. So if you don't mind, I will just mention from the research at Centre for Aging Better done, and by the way, I'm no expert. I regard you all here much greater expert than me, but I do chair the Centre for Aging Better. So thinking about this and the distance we have to travel, just taking poverty, relative poverty, pensioner poverty is increasing. So we have about 2 million people of state age pension living in relative poverty at the moment in the UK. People in our poorest areas expect to live 17 years longer with a disabling condition than those in the most affluent areas. Older people from some ethnic minority groups, as you could expect, are worse off than their equivalent, the equivalent white people. Poor health, it limits so many people's ability to work. And I think one of the ways in, maybe in this country at the moment, is through our economic inactivity levels, which for the first time, Andrew, is really concentrating on the 50 to 65-year-olds. Is this a lever for us to get older age and the older age worker in and of real importance? But there's no question, and I know there's the argument between different organisations about, is this just ill health? Is it people taking retirement? Is it caring, etc.? But the truth is, poorer health is certainly contributing to that. You mentioned social isolation, and people in their 50s and 60s in this country are increasingly living alone. Financial inequalities you mentioned, and the gender pay gap. We have got all of those. So in a way, your report really chimes with where we are, but my big question is, where do we start to correct that? Now, we at the Centre for Aging Better are going to do a campaign on ageism. We're in the very early stages of designing that. I really want to know what that award that was given to the company in Thailand, because that may help us as we move forward. But I do think we ourselves are our own worst enemies as we get older. We expect to be less able, as everybody has said, and the fact that we almost or many people embrace ageism. I must say I don't, but a lot of people do, and they just live as if they will be disabled. We have got to change public perception, because I think that would be really important. And from the Centre for Ageing Better's point of view, we're going to have a real go at trying to engage with employers. We have an employer pledge, which we'll be launching very soon. And we already have certainly got sign up. In that pledge, it's about flexibility, hiring positively, encouraging a healthy older age through what the employer can do, etc. So it all says the right things, but I wonder if we could spend a bit of time sort of thinking, where would we start?
I agree.
Where do we start to change it? How do you get 6 or 7 departments of state in this country to sit around the table and take it seriously and do something in a concerted fashion? So for me, they're just a few thoughts, but everything you have said, we could find really bad figures for you here, and they're not moving in the right direction.
And there's 3 things that I think you raised there, and hopefully we'll pick up in the debate. The first is just the need for action to do something.
Yes.
Secondly, the disconnect between almost a growing awareness of the importance of this, but actually what's happening in the UK in particular. There was a third one which just slipped my mind. There's always 3 things, isn't there? The third one slipped my mind, but I will come back to it a little bit later on. But I know what the third one was. I think, for me, and I'll flag this up, the other issue is sort of how much information there is in the concept of age. Because one of the things about ageism is we're saying, well, you've got to look at the individual, not their age, but that then brings in the inequality issues as well. And perhaps policies need to be targeted at individuals rather than at age groups. And I think that's always one of the challenges. Let's come back to that later.
Can I just say one other, just a very personal thing, in that we need to remember education. So I come from a poor middle class family from the Midlands, and of my cousins, they're all dead but me, because I'm the only one who had a decent education, and the only one who didn't get diabetes, heart disease, work in factories. I am privileged, but the thing that allowed me to actually grow up rather better, eat properly, exercise, was actually that my education separated me out. I just passed the right exams. And I don't think you can forget that. That does take us back to where you come from. But how do you therefore concentrate some of this effort on people who have never had the right beginnings? And that for me comes into the inequalities as well.
Education is a phenomenal geoprotector, it really is. Alana, if I can move to you now, perhaps just a little bit about the decade for healthy ageing, but also I'd be really interested in how you found the response from governments. We're talking about who are the agents to get change and how it varies around the world in terms of the initiative.
Yeah, thanks, Andrew. It's great to be here. And it's great, in one of the last objectives in terms of the roadmap is really aligning with other major initiatives. So the United Nations Decade of Healthy Aging, which started from 2001 to 2030, is aimed at fostering longer and healthier lives. So simply very well aligned in terms of the work. The decade is strong, the opportunity for 3 reasons. 1, universal almost political commitment, and a plan that goes with it that can evolve as new evidence comes in. The second thing is people need access to knowledge beyond this group and others. So there is a knowledge exchange platform in multiple languages, which can enable people to find and share knowledge. And the third thing, which the DG launched last month, which is a new collaborative, a mechanism for all of the diverse stakeholders that we heard about that are needed to act, to come together. So you asked about government responses. So in terms of the decade was developed through this highly interactive, iterative, consultative process. And during that process, there was 89 governments who made substantive inputs into the plan. It was then consulted within all ministries of health. 194 governments endorsed the decade and the plan. That's pretty high commitment. Then, knowing that ageing is not just a health issue, it went to the United Nations General Assembly And there, 77 ministers, foreign ministers of foreign affairs, co-sponsored a resolution that then was adopted by the UNGA. Really strong political commitment. And I think another key point that is really important is it's not ground zero in terms of what countries are doing. So we did a baseline report in 2020 for the start of the decade. And already countries are making commitments. They have, we work almost, monthly with countries on developing national plans and strategies. So they've made lots of investments in a large number of areas that were discussed today. But there are still huge gaps that without increased investment, we're not going to get to. And things like age-based discrimination, knowing who's responsible in government for linking sectors and stakeholders together, improving data and research, and certainly longitudinal data are just all examples of huge gaps that, at least in the time of the decade, based on where we're seeing progress now, are unlikely to be met. But governments are committed.
And how does it vary across the world? Is it because we've got the richer countries have got a very high proportion of older people, but also most older people live in lower middle income countries. I wonder if there's any difference across income categories in terms of the approach to the topic.
So in terms of commitment,
yeah,
I think we're seeing increasingly a large number of low and middle income countries where we've got the fastest rates of population aging and the largest numbers of people existing, recognizing more and more that those investments need to be made. Yeah. One of the big challenges, which I think was highlighted in the NAM report as well, is that it's the 1090 gap. Most of the evidence is high income country. Most of the people live in lower middle income countries. Yeah. So unless we're investing in research that can enable those countries to identify solutions and adapt them to their context, it is much more challenging for countries to actually move this agenda forward.
Yeah.
The commitment is there. Support is required in terms of the knowledge, the sectors bringing them together and supporting them to translate really good evidence into actions in country.
As economists, one of the things I notice is that actually in the lower and middle income countries, there's a much greater awareness that health and investments in health and education boost the economy.
Yeah.
Whereas in the high income countries, there's a disconnect. I think that happens at younger ages, but not at older ages. And I do hope we can get away from that. But let me turn to David. I know you specialise in healthcare and health systems, but McKinsey has also launched this Health Institute.
Mm-hmm.
So can you just say a little bit about the Health Institute and also where you think the private sector comes in on some of this?
So we, as McKinsey, have launched something called the McKinsey Health Institute. It's a non-for-profit, and the idea is to focus resources on some of the sort of under-emphasized aspects of healthcare. So mental health would be one, but aging is another. We're sort of going through and trying to bring a private sector perspective and a little bit of the sense that actually the private sector will have to be part of the solution on all of these things, as I think it must be on aging for a variety of reasons. I think the thing is launched. I'm not terribly close to it, but it is launching a report on aging, which I think reflects many of the same themes in the NAM report. I think a bit more focus on the role of the private sector and of innovation and that sort of things, but I think the conclusions are very consistent. So the second bit of reflection about the role of the private sector. And this again, I think is clear in the report, it has to be a fundamental part of it. And I think the ecosystem that supports healthy aging, there's a big role for the private sector in that. And I think we're already starting to see the private sector play a role. I think we're seeing it play a role as employers. And so we're increasingly seeing employers thinking about health in a much more holistic way. So not just about physical health, there's increasing focus on mental health. There's increasing talk about sort of purpose and that sort of spiritual side of things, and there's increasing, particularly during COVID, an increasing focus on sort of the importance of community, and sort of as COVID has lessened pressure on organizations, the recognition that actually, while remote working is powerful, there is also real value in sort of the community aspect of things, and those are all important parts of aging well. And so I think, as employers, the private sector is playing a role. I don't think the private sector has yet really thought about the role of older people as employees, and the sort of the data that you shared was pretty compelling, but there is quite a significant issue. So I don't think that is yet there. And I think making the case that the economic contribution for older people can be substantial, and appealing in effect to the bottom line of all the private sector organizations, I think will make a big difference. So there's, I think we're starting to see some progress there. I think the second aspect then is private sector as a provider of services, as a provider of products, as an engine of innovation. And then I think there is some good news. One of the things I did before I came is I looked at the data on investment into I think they call it Gerontech, I think is the trendy phrase for that. Though I should tell you, when I looked, the first place I looked, all these databases have funky names. So the first one is called Crunchbase. And in Crunchbase, the category is older people and disability. So it's still within that, these things are confused. So there is, further to go. But, the data is, we're starting to see this. So there is, I think in the US, the investment into that sort of sector went from 300 million to about $1 billion in the last 2 or 3 years. So, you're starting to see the investment come up. People are starting to see the market opportunity. You're starting to see services be tailored towards sort of older people. But it's only the beginning. It's only the beginning. And I think one thing to be thoughtful about is, what do we need to do in order to enable the private sector to invest more in that space? And is that about regulatory changes and incentive changes? Is it simply a case of talking more about successes? But there's work to be done, I think, on that in order that the engine of innovation is focused on healthy aging.
Yeah. And that split between the workforce and products and services is a key one. There's actually a few of my students here. I ran a course called The Business of Longevity here at the business school. And I'll steal a wonderful line from Laura Carstensen, who says, business is the distribution arm of social change. And it has a huge role to play, I think, in this. And like you, I begin to notice it increasing. I think there's still a challenge. I find it unhelpful. We talk a lot about a silver economy, which tends to focus on frailty and needs, and sort of that statistic that Japan sells more adult diapers than baby diapers now. And that's not the vision that we've all been talking about today. And I think that's one of the challenges. I think businesses also have the same problem that Carol was alluding to about governments, in that is this sort of healthy aging longevity, is it a horizontal or a vertical? It's relevant to every single topic, but which sector has it at the forefront of it? Obviously health should have, but as we've seen, it's a lot more than just health. So I think that's a real challenge for the business sector. But you begin to see some quite big initiatives happen. Carol, let me just come back to you, because you raised a point I think is really important here, and we talked about the systems nature of the change that's required. Where should responsibility within government lie for that? Whose agenda is this?
Well, it's one of those wicked cross-government agendas, isn't it? And I've just done a wicked cross-government agenda called illicit drugs.
Yes.
And just to learn from that, which is what I've found really valuable, was I don't know whether you would consider it appropriate for the longevity discussion, but getting 6 departments of state, not to nominally say, isn't it interesting? And we really appreciate the problem, but to have them in a unit. There is now a cross-government central unit for drugs with a minister driving his other ministerial colleagues, with an annual report to Parliament. And there was money with it. I mean, we have some money, but I have seen a distinct change from before, when the Home Office was mainly drugs and everybody else sort of came in very ineffectually, and it didn't work. And for the first time, each of those departments has taken on its shoulders its responsibility towards illicit drugs. So is there an equivalent in our space that we need probably more than 6 departments? It probably we need 8 or more, but can we get them to see the relevance? And I sold it not to say you really should treat drug dependent people better. I said there'll be less murders, there will be less acquisitive crime, and you'll need less prison places. So what is the hook that would really get the government to say, we better do this? Where have we got the that message that makes them think, oh my God, yes, well, if we want murders to go down, we do have to do something about this problem. And if we want them to consider we can all age well and we can contribute and feel good about ourselves, what's the hook?
Yeah.
You should all know it because you're specialising.
Yeah. I mean, so the UK a while ago made a commitment to 5 more years of healthy life. So this may not be a good time to bring up this analogy, but the Bank of England has an inflation target. It may have failed miserably at its inflation target at the moment, but it has one. It has certain instruments, and it has this approach of saying, when we pull these instruments, we'll achieve this target. Should there be something like that for the UK?
But I think we need some levers, don't we?
But also just, a longevity committee, I
Yeah,
don't know who's made up of it, but with a
Yeah.
set target of
A
healthy
set
life
target,
expectancy.
And we have, in the drug world, we've now got set targets from the government, and they're very clear. And that's the way so I think we need something that pulls people together.
John, whenever analysts ask me which country is doing it best, it's always you've got to go to Singapore. I don't know if Singapore feels it is or not, but how have you found this cross-departmental approach? How do you get it to work in Singapore?
So we started off by saying that it's financially not sustainable in Singapore. The national healthcare expenditure doubled between 2010 and 2018, and it's going to triple between 2018 and 2030. This was even before COVID. That's not sustainable. The government has to raise the value-added tax now with all these problems with inflation. And so I think that in Singapore, actually, it's become clear that the current model is just not financially sustainable. So we need a new model. Now, I think it's critical. So the NAM Global Roadmap, the UN Decade for Healthy Aging, all came at the perfect time because now there's evidence, there's a roadmap, there's recommendations. It's not just one person saying this, but the whole global community saying this is a way forward, which at least the Singapore government is embracing, but it involves every sector of society. It involves redesigning. So the trade unions are involved in our conversation, employers, universities, healthcare systems, schools. It really requires a whole of society change.
It does. And, I'm an economist, I'm biased, but that Clinton phrase, it's the economy stupid, I think is a great lever to come in. And it's just extraordinary disconnect. We know that health has boosted the economy throughout all time. You've seen it through COVID that you can't have a healthy economy without a healthy population. So I think that it is one of the levers. But the other thing I wanted to ask you about, John, because you're talking about things that could be done. You mentioned about a person-focused and rather than a patient-focused approach. Am I right that Singapore has changed its costings around health budgets? So now it's a per capita basis rather than a per. Do you want to say a little bit more about that? Because that seems a really interesting change.
Singapore this year has declared that it's going to move to capitation for healthcare financing. They're aware that we don't have a good model to come up with the true cost, and that's why experiments like the Queenstown Health District to really cost. And I think that people have not actually embraced the WHO definition of health. People know the physical aspect. They're beginning to realize the mental aspect, but no one really embraces the social aspect. And you need all three for well-being. And really trying to come up with the cost of how do you really cost out all three elements, because without good costing, you can't run any business.
But just to emphasize to others what capitation means. It's sort of rather than paying for every heart operation or every arthritis drug, you just give a health budget to people and think, how do I promote their health? And that seems just a stunning realignment of incentives. But Alana, perhaps I can come back to you because the decade of healthy aging, health sector gets its big and big checks, but as Andy Burnham said, it's not really about health outcomes, it's about health services. And John, you were quoting 80% of health outcomes are outside the health sector. So how does that work? How do you see it working with the decade of healthy aging? Do we focus on the health sector or do we focus outside?
I think if we were only going to focus on the health sector, it would be a WHO decade.
Right. Yeah.
The fact that it's a UN decade is an acknowledgement that in fact action needs to be taken outside. And then if you look at the action areas of the decade, so one of them is changing how we think and act towards age and ageism, so tackling ageism. The second one is around how you create communities that are better places in which to grow older, which is all of the multi-sectoral action that needs to happen. And I think, as Andy said, it has to happen where people live. So how do you get the multiple levels of government to deliver results in people's homes and where people live? And then the other areas are integrated healthcare and long-term care. So the more health, recognising the more health sector part. But we need to make a much stronger investment in the social determinants of health if we're going to deliver improved health outcomes forward. So that's not only about the health sector. Like, you know, the gains we've made in longevity have largely been made through investments beyond health services. It's going to be the same thing in terms of health.
And David, I assume you do a lot with the UK health system. Stress times, what do you see happening in the health system at the moment, and how are you seeing your clients adjust or adapt to this agenda?
Well, so it's a good question. So I think structurally, you would say the UK health system is really well placed on this agenda because it's a single payer system. So if you're in the US, you've got a fragmented system. If you invest in healthier lives, your insurer may just go to a different insurance company, you lose all the benefits. So, the UK in some ways is really well positioned. It's got probably the best data, except for Singapore, of any health system. So it should structurally, it's well positioned. But the reality is that a lot of the initiatives that are outlined in the report are things that the NHS has been trying to do now for 15, 20 years, from Darcy's report, the next stage review, the 5-year full review, it all says the same sorts of things. Very little of it has happened. When you talk to the Treasury, what they say is the NHS is always 3 years into a 5-year plan with all the cost in the first 3 years and all the benefits in years 4 and 5. So the reality is the NHS practically has not been able to make progress on this agenda. And I'm not sure that I see that, in all honesty, changing, because the fiscal environment is a really, really difficult one. The wait lists and the challenges we have around non-elective pathway, the productivity challenge at the NHS, all of these are traditional, primarily acute challenges facing the system. And the way health systems often work is you fund them just to the point where the management team is almost overwhelmed with business as usual. So trying to get them to do anything beyond that is really, really challenging. So I am pessimistic that without some substantial changes, without really robust political leadership and managerial leadership, that we're going to see much movement on this agenda in the next 4 or 5 years. I think the flip side of that is you can do the maths. It's fiscally unsustainable not to make these changes. So you've got a sort of feeling that the tanker is heading towards the iceberg, and everyone knows that, but the ability to shift it just isn't there.
Yeah, as a former economic advisor to President Nixon, who defined unsustainable as things that can't go on forever don't. And it's a very brutal way, but you do get that sense. I'm going to open up to questions in a minute, but before I do, I'm going to ask everyone, because we said we've got to do something. I wonder if the one thing that you think is most important, or at least from your expertise is most important, that needs to be done. I'll kick it off just to give my panelists time to think of their own answer. For me, it's about raising employment from 50 onwards. I think the obsession with state pension age is misplaced. We see a big fall in employment from 50 onwards. And if you're not working in your 50s and 60s, you ain't going to be working after state pension age. And that's a way of combining health, education and GDP that I think is least controversial. But Alana, do you mind if I start with you?
I'm happy. I think if we're going to make investments in anything, we need to change how people think, feel and act towards aging. I have great confidence that if people have more realistic understanding of aging and the opportunities it provides and what the investments are, I believe we can shift it. But I mean, I led last year a global report on ageism where 1 in 2 people around the world are ageist against older people. So if half of the population had negative attitudes towards older people, the sort of shift, even in terms of getting people to want to work longer, creating the environment in which people can work longer, providing, healthcare which is not ageist. I mean, so really shifting how people think, feel and act towards aging has to be a priority for every other recommendation I think that came out in that report.
And it is, I mean, I think you're obviously right. And I think what is extraordinary is this is a really different moment in human history. One of the things I say to everyone all the time is demographers have done a disservice by focusing on the aging society, which is just telling us there's more old people than young people. The real change is the young have never been so likely to become old. And I think that's how we start to try and grasp that. But it's a really hard thing to get because we've never had that before. John, I think, said ageism is a prejudice against your future self. But if most people only had a 20% chance of getting old, that's why ageism has been there. But I think now it is a prejudice against your future self, and that's a really fundamental thing to change.
I want to make one brief point. I think the other point related to ageism is we need to invest in evidence that works.
Yeah.
So a lot of things, interventions are not evaluated, those evaluations are not used, and we invest, all of us, millions and billions of dollars in things that are useless. Yeah. So in terms of ageism, we only know that there are three things that work. Yeah. Policy and law, education, that needs to have certain criteria, and intergenerational contact. Yeah. With certain reciprocity, equality, etc. So, and it's a challenge, like investing in campaigns, the evidence is really poor. So we have to be careful to make sure that we evaluate, and things can do that, the way that we do these campaigns so that we actually know what works. So we need to tackle ageism, but we need to invest in those interventions which are actually going to deliver the sort of results.
Carol.
Well, you've both taken one. I would have said ageism is really beside. No, I agree, because it really involved in all the other things. It really is the thing that we must get to. But I do think for where we are in this country at the moment, using our economic inactivity and getting the 50 to 65 into or able to work, because you will then be more likely to work after you're 65. If you lose it at 50, you're not coming back.
Yeah, exactly. On the ageism point, you said you were working on a campaign. Who do you think, I haven't decided yet, but who are the key people you are trying to focus on in terms of, is the public?
Here we are.
There's some work going on at the moment to identify, to do some segmentation of who would be. And the evidence is already, I think, in the literature that younger men are more likely to be ageist than other portions of the population. We are doing some work on that at the moment to decide who we would like to target.
But it's the broader public, and within that certain groups. Interesting.
And I think we need to take on board very much that it has to be evidence-based, because without that, and anything we do has got to be able to target and be measured.
I think that's the other thing. This is a huge social experiment. We have some good ideas and we have some data, but there's a lot we don't know because we've never had to do this before. So I think it is.
Make it fun.
Yeah, it is high stakes but fun. David, what's your magic trick?
I'm keen that we show some results. There's a horrible statistic in the NHS that something like 2%, 1% of the population contribute 60% to 70% of non-elective bed days. So these are the people who are in hospital for emergencies. It's a very small percentage of the population. It's not entirely older people, but it overwhelmingly is. And we know we can do better. So if you look at the data globally, other health systems, places that do it well, have 50 to 60% fewer bed days per over 65. So we know we can do better. So I would focus on developing a service, an older person service, that has as its key metric keeping those people out of hospital, those high complexity, high need patients out of hospital. I think that is better for them, because there's some statistic every day you're in hospital. If you're over 60, you lose about 5% of your body mass. It's horrible, or muscle mass. So that's, so it's better for patients. I think secondly, it demonstrates results to politicians that this agenda actually can deliver things that matter to people. And third, you create fiscal space, because that's a really big expense, and then you can reinvest that in some of these, preventative services. So I like that as a way of just getting started, because I think you could show results in 6 months if you really try to do that.
Linda and John, I'm going to spring a surprise on you. What's the one thing, you're not experts on the UK, but you think would be key for the UK to do?
Can I suggest two?
Yeah.
So first of all, I agree with all the points that are made, so I'm not going to reiterate that. But I think the first thing is that what we call a health system is not a health system. And we need to redefine what a health system is. And the pyramid that John showed of, the 5 dimensions of the health system, which go from clinical care for individuals to how we deliver the conditions for a population that amplify the opportunity to be healthy, to the social determinants of health. That's a health system. And the challenge that we have in many countries is that the bottom parts of that pyramid that make up a health system are public goods. And in order to create health, we have to recognize the need to build the public goods that can deliver it. And the return on investment is higher for those public goods than it is for the individualized care, which only delivers at most 20% of a population's health. So we're swimming uphill, and you can't swim uphill unless we use the evidence and redefine what a health system is. What we define as a health system is actually a medical care delivery system for people who are already sick. And it's not, in many countries, including the US, it's not doing the job for that anyway. So that's one point. And we have lost the narrative on the role of public goods in a successfully capitalistic society, a point that Adam Smith made in 1802, that capitalist societies will fail unless they adequately invest in public goods. The second thing I'll say, just to add one dimension to what you said are the correctives to ageism, Alana, not that you don't know it, but just to draw it out, is that we don't have roles in society that utilize what older people want to contribute. On the work side, we're not employing older people, and we need to fix that. But on the volunteering side, we've demonstrated in a program called Experience Corps, which I created like 100 years ago, in which older people volunteer to support the academic success of children in school in a model that's designed for impact, both in terms of the academic success of the children and in terms of promoting the health of the older adults. It works. But what happens in there is that the ageism in that school plummets because older people are in roles that are, because well designed, are delivering high value that nobody else could have brought. And so the roles for older people that are visible, that are designed to create impact, that are observed to bring value is what dissolves ageism.
John.
Okay, well, firstly, I agree with everything that's been said, but if we are trying to see how we can take this issue further in the next 12 months, I would really try and identify trusted people across society between 50 to 80. I wouldn't stop at 65. I would go from 50 to 80. People who are trusted, who understand the issue, to actually form a coalition to start developing culturally sensitive programs within their countries. So what works in, we've gone to Manchester, we've gone to Boston, we've gone to Japan, we're going all around the world to try and learn what everyone is doing, but ultimately we have to develop something that works in Singapore. I think government is critical. You need to have the government involved, but the government is trying to deal with lots of fires right now. And I think there's so much human capital in universities, in the public sector and the private sector who have got time, wisdom, and bandwidth. If we actually form the coalition using evidence and develop almost rapid prototyping in a learning environment to say that we don't have the answer, but if we don't start now, we're never going to get there. And really trying to say, can we develop, you can't boil an ocean, but you can boil a teacup. Can we identify a community in our respective societies, which is reflective of the country, which if we can start seeing the needle shift, at least tells us we're on the right track.
Yeah, it's very interesting because if you think about the Industrial Revolution, which threw up all sorts of social problems and challenges, the first group to sort of scale up and try and tackle that was the social sector. The YMCA, the Salvation Army, the cooperative movement, and then after a while, government took on those services and started to provide it. So that's very, very interesting. But questions from the floor? Yeah, that's right.
The comment on what David said. At one point, I was managing director of Bupa Health Dialogue, and we were trying to manage long-term conditions. It was a link in Bupa into the NHS. For many, many reasons, it was quite stressful, not least because we couldn't share data with the NHS. But going back to that was 2010. And then I was CEO of a company that had the shared decision-making contract, national shared decision-making contract. That we did a massive online thing for that. That's never been used as far as I understand. There was a major NHS shake-up and we don't even know where it is. So all those were trying to save the NHS money. So to go back to your point, I think, to try and get anything through the NHS and to try and get private organisations involved or any change at all, you're looking at, I don't want to be cynical, but it's at least a 5-year thing to get anything through and change a policy. I'm just going back to I think all your points. If you could get the government to say, okay, we're going to tackle ageism because it's actually affecting the economy, that's a massive lever that they will do. And then maybe you can get, older people into the workforce. Then you maybe get the private companies sort of, working with, say, healthcare companies or supportive companies to try and support those workers. I think that would be the best way into helping this ageing society. I don't want to dismiss the NHS because I think it's a wonderful thing, and I think there are many, many wonderful things about it. But to action change quickly, I think it needs to be another bridge. That's my sense.
Julia Randall-Carr.
Yeah, thank you. I go back to the point that Professor Carstensen makes at the Centre of Longevity at Stanford, where we've got this tremendous program called the New Map of Life program, which is highly aligned to the work we've been talking about here. But the role of business in terms of being a driver of social change. I mean, there are some fantastic examples of companies who have really rethought, employment models, for example, like Unilever or Swiss Re. What do you think is the best way of promoting these great stories and examples of change in action that can people can learn from, and a mechanism to bring together this global experience in practical ways that can be implemented through businesses, which does drive the economic bottom line for these companies?
Does anyone want to pick up on that? Or?
I can give it a go. I think what you're getting at is the point of inspiration, how existing companies can also inspire others. And people need to have access to that knowledge, yeah? So, I mean, for example, in the age-friendly cities and community work, so the work that Andy's was speaking to, we have a platform which enables cities and communities to share the great work that they're doing, that inspires others to take action. There's not the same thing in the business sector. Yeah. We have the Decade of Healthy Aging, a platform where businesses can engage. Maybe that's what we should be doing, starting to showcase a lot more businesses, what they're doing to be able to inspire others. And I think there's some great work happening. More people need to hear about it.
Sorry, I don't know the name, but do you want to?
Louise. I'm in the business of generating evidence. I work in academia. It's just one point really. We often talk about evidence and we say we do have a lot of evidence that demonstrate the facts, that we need to focus on things. Where I think we're not doing as well, not because we don't have the tools, but I think we might not frame it the right way, is that we need actionable evidence. We do a lot of amazing writing on describing problems from different perspectives, and that's good because that means people can understand the multidisciplinary challenge and intersectorial challenge that we have here. But very rarely do we push that evidence to the different key stakeholders who can action it in a format that they can act on. And I think there is investment. So in England, there is more investment in applied research. where that is a mandatory component of the outputs we generate as researchers. And I think it is a good model in some way. So thinking about how can we action the evidence, because we're completely overwhelmed by reports and by things. So that's one thing, I think we can do it. And coming back to the point of ground zero, there's also a benefit in showing evidence and also showing what's happening. I think there is value in making that point quite clear that it's not ground zero. We just finished a piece of work where we were looking at how much age-friendly communities actually consider the Sustainable Development Goal and how aligned are they already with the decade of aging, because it's just coming. And we surveyed people and we asked them, oh no, we do age-friendly city, we don't do sustainability. When we looked at what they actually do with the lens of the SDGs as opposed to age-friendly communities, more than 60% of them are actually working on sustainable development goals. So coming back to the capacity, how do we bring policies together? I think making it quite clear that many of the policies are already doing things, they just don't name it the same way. And I would think that is empowering when you go back to a city or Manchester or the other in England and say, you told us you're not doing anything, but actually you're doing way more than you think. So I think there's just value in that aspect.
Yeah, so I think that's right. I think the other thing, though, I'd be thoughtful about is how much more evidence do we actually need versus pushing towards experimenting and actually just trying things. And certainly for our clients, we always say, look, you don't be paralyzed by uncertainty. You're never going to have enough information to be completely certain. You're better to find a way to experiment, see what works, and have a portfolio of things, see what works. And where you do see positive results, then crowd in resources. So I think balancing the need for evidence and actual evidence with the willingness to experiment. And that's hard in government, easier probably in the private sector, but I think that's going to be an important part of unlocking this.
I just wanted to link with, so one of the things that we just did was we created this partnering kit, yeah, which has lots of key messages around the decade, but it has a logo, yeah, which everyone could use. We could put it on here to be able to enable anybody who's working in the space, who's doing work that could contribute to the deliverables of the decade, to brand it, yeah? This is my contribution. And it comes back to the point of we need, cross-sector, cross-disciplinary, but we need to be able to give them opportunities to be visible in their contribution, yeah? And so we don't do this normally, but in terms of the decade, we decided to try and experiment, a bit like David's suggesting, and enable everybody to take our logo and put it on anything that they think there are certain criteria you have to check, yeah? But to show that they're doing something, yeah? And then we think that by doing that, they can inspire others, they can make connections, and we can see that there is a much broader movement of actors actually doing things that will foster longer and healthier lives.
It's interesting. Sorry, Karen, do you want to add something? I think we'll just have one more question, but Stephanie had a hand up, so let Stephanie ask a question.
Yeah, I'm sorry, I'm Stephanie, I come from the investment community, so very much a private sector lens. So I used to be the co-chair for diversity, equality and inclusion at Uber, and I was in charge of managing about half of Europe, 19 countries across Europe. It was very easy to create change because I joined at a time when we'd lost the TfL license, we'd had extremely bad press about our CEO, and he'd been ousted, and so they were hungry for change. But the way I saw it succeed in the sector, and obviously Uber was part of that leadership in that sector, was a bit of a carrot and stick. So the stick was, there's a gender pay gap report that every single employer in the UK above 100 employees has to fill in. And it's published, and if you don't look good on that, you don't look good when you're going out to look for candidates. And that was the thing I carried to all the way to the global CEO and said, if we don't create change, this is going to look horrendous on you. And then I know the UK then talked about an ethnic minority pay gap. And so they started paying attention to diversity of people coming in. I also worked with our head of LGBTQ+ team and our Black at Uber team and our Women at Uber team. There was always something that an event that anchored the way we would open a conversation and create engagement internally. And then what we did was we created our equivalents across every other private sector companies to join us up. And so Black and Uber or Black History Month became Black History Month for every single professional company across our space. So I'm sharing this because I think when it comes to ageism, what we've now noticed in Uber is we've begun to measure age diversity as a form of DEI measurement, but that is something that our team pushed for and came up with themselves. It is not a national agenda. And so I would just ask, like, what do you think could be done to create the right level of stick, to create the right, opposing opposite carrot inside the company to move towards that? And do we need a caring employer index? Do we need better business awards measured by age diversity or something? I'd just love to understand, what kind of ideas or thoughts you might have in that area.
Tina, do you want to answer the question? Is that what we're?
Yeah, well, I had a chat with Stephanie earlier, but so Business for Health, which has literally this week launched the Work Health Index. We have a lot of discussion around including age or some sort of around what provisions employers are making, for age. So that was something that we spoke to the Centre for Aging Better about, and we were really surprised that Share Action, that do the Workforce Disclosures Initiative, and have a great survey that actually is used by investors in terms of assessing their portfolios and on the basis of how they treat their employees in the workforce. They didn't have age on any questions on age on their series of questions, which we were really surprised by. So we had a whole bit of conversation about that. So we worked really hard with the CBI in the design of the questions to address exactly that, what provisions employers are making, and tailoring provisions around the special needs for depending on what age you are. So
any thoughts from panelists on this issue? How we get on the national agenda at that level? Excuse me.
So I don't know how to get on the national agenda. I am very clear that sort of transparency and reporting is a critical part of this, and it forces the right kind of conversations and it forces the right kind of action. It doesn't necessarily have to be government either. I mean, it can be voluntary. And if you start to get a coalition of organizations that are reporting on this, that sort of tends to gather momentum. I think that's probably a bit what you saw with Uber. So my instinct would not be to wait for the government to enforce it. My instinct would be to,
The CBI to
the CBI and get, civil society organizations to push for it and do it that way. That would be my instinct.
I have one, so I think that with all this debate, there's always two dimensions of what I mean. One is the extent to which you take a life course approach or focus on older people. Another is within older people, whether you distinguish whether actually age is so important. And I'm doing some work with Darren Asimoglu on labour markets in the US, and it's really striking to see what's happening, because actually in the US, a lot of older people are doing really well in the labour market. They're working for longer, they're in the high paid jobs, they're in the high prestige jobs, and they get age-friendly jobs. So anything that sort of is age-focused, they're doing really well. Unfortunately, not every older worker is doing very well. So I think that's one of the challenges. So the Business for Health is interesting because it focuses on health. I think that's the challenge I have with this sort of age. And part of the sort of approach of ageism is that age is not a very revealing number. And I think that's that. And I don't know the way to do it, because we do have ageism, so we have to focus on the needs of older people. But if you have legislation that says you need to sort of bolster older workers, it's going to give a lot of strength to a lot of people who are already doing very well. And I find that dilemma a very hard one to do.
Ageism doesn't only affect older people.
100%. Yeah.
But, I mean, it really is something that we see across the life course and affects people differently. We know in Europe, in fact, younger people report more age-based discrimination than older people.
Interesting.
Yeah. But I think that the issue of inequities within generations being so important, because obviously they tend to follow you across life, and not trying to play off one generation against another is an important strategy, I think, going forward. And I think we need both. We need to invest in the life course, as I think the report clearly states. But, those investments that we're going to be making in the first half of life are not going to benefit existing older people. So we need to be investing also in the second half of life, which I guess is where the nice marriage between the National Academies work across the life course and the decade, which is predominantly focusing on the second half of life.
I know there's lots of other questions we'd ask, and I always say the irony of talking about team with longer lives is we always run out of time to talk through the issues. But I thank you for panelists. Thank you very much. Steered a large number of people with huge views to come up with something that was remarkably coherent and clear and pointed. So thank you for your inspiration.